Hi, this is Dr. Paul with Car Injury Care TV, and we're talking with Dr. Nick Venturina here, and it's carinjurycare.tv/North Tampa, where we answer the most common questions regarding automobile accidents. And the question that we're going to be talking about today is a lot of times, why do we not feel any pain after an accident? Or, just the opposite of that, why does it still hurt after an accident years and years later? So those are the two questions that I'd like to present with you, and I'm sure you've seen that with your patients. So let's just ask the first one. Why is it that after an accident, sometimes patients do not feel any pain immediately, but they may weeks or days later?
Oftentimes it's because of the shock of the accident. It's an adrenaline rush. Your body produces specific chemicals when you've had a traumatic injury like that. And sometimes they're produced in such a high volume that you simply don't feel any pain. It's not uncommon that you can go, have a significant trauma, but not feel the pain of it for weeks or months, even after the fact.
What, in your experience, with some of the patients you've seen, what generally, what generally, how long has it been after an accident until they start noticing the pain?
Typically, it's in about that 3-week to 5 or 6 week period. But if you pay attention to the Florida statute, they give you 2 years from the date of your accident to file a claim. Mm-hmm. So scientific studies show that it can be as often as much as 2 years, depending upon your age and your underlying condition. If you were very healthy and no diabetes or heart disease or things like that, the more healthy you are, the longer it may take for those physical effects to be felt. And typically what you'll find is a lot of those people don't relate the accident to the problem. They were just out gardening. They did it every day prior to the accident. 3-4 months after the accident, they're out gardening and somehow they hurt their back, doing the same normal thing that they've done all the time, but don't relate that to their back was now weaker because of the injury, and now they hurt their back doing the same thing they've done for days and days and days.
I see. And what's your experience with the patients that you've seen as far as how long they typically have gone before they came into your office?
It varies, but we've had patients that I had a young girl who was a cheerleader in high school, and she was in an accident 3 months before coming in here, and she just related all of her pain that she never had before to cheerleading. Well, I had all this trauma from cheerleading. It obviously caused this pain. Not thinking that, when I did my consultation and pulling it out of her that she was in an accident, well, it could have been from the accident. I didn't have any pain right away. Well, here it was 8-9 weeks later, and she's thinking it was high school cheerleading from 4 or 5 years ago, but it couldn't be the accident she had 8 weeks ago.
I can understand that. And then prior to that accident, her cheerleading activities were normal.
Right, and never had any complaints about it.
Really, when you start stressing your body a little bit, it kind of surfaces.
Sure.
Is that what you're kind of saying?
Sure.
And one of the common things that I hear people say is why does it still hurt years and years later? Like if somebody's been in an accident and they've gotten treatment, medicine, whatever, why do they still have trouble maybe years later?
It's totally based upon the fact that their tissue has healed improperly. Like I've said before, your body is always going to heal itself. Whether it heals right or wrong depends upon the treatment and how quickly you get that treatment. Because if your body starts to heal improperly, it heals with scar tissue. Scar tissue is weaker than your normal tissue. It's less elastic. It's got more nerves that grow to that scar tissue area, and those nerves take less, they fire at a lower threshold. They take less stimulus to make them fire. So you feel pain easier. You've got more nerves, so it takes less of a pain to feel it, and it's stiff. It doesn't move as well, so you become stiff. And it's weaker, so you're much more likely to be re-injured. So when I see a patient that says, I've had this pain for years and years and years, and we can relate it back to a trauma like a car accident, we know there's permanent damage or there's been scar tissue formed from the accident, because that's why they're having these 4 specific main symptoms.
Is there something you can do to help those people?
Absolutely. We try to restore their function to as close to normal as possible. Now, you can't undo permanent damage, but you can improve on the level of function that a patient has from that. So if we can improve their function, increase their range of motion, get the muscles stronger, get them more stabilized, then the effects of the accident, even years later, will have much less of a detrimental effect because we've worked around some of it to improve the way the body works. And just by its very nature, they will feel better and function more normally.
What have you found to be the number one reason that people still hurt years later after an accident, that they could have prevented early on in the accident?
Not getting treatment. Just thinking, well, it'll go away.
Well, what kind of treatment are you talking about?
Well, specifically you need physical treatment when you have a physical injury. So whether it's a sports injury or in what we're talking about, an auto accident, when you have a traumatic injury that causes physical damage, a lot of these people go the traditional route of just getting a muscle relaxer or a painkiller, which is, you know, what their primary says or what maybe even the ER at the hospital says. But those are simply masking agents to help you feel better. But their purpose and their goal is not to improve your level of function. So physical medicine works with the body that's been damaged physically. We work physically to try to improve the normal level of function that your body would have so that it will heal normally and you won't have the as bad residuals from that.
So they could have went to the doctor, say the medical doctor, got medication, and in their mind, they're doing everything that they think they should do.
Correct.
But then they just heal wrong because they're not getting physical treatment for the problem. What could they have done differently?
Gotten physical medicine. I mean, specifically, had the joint manipulated where there's pressure in the joint causing pressure on the nerve or disc pressure. They could have gotten some electrical stim or some ultrasound, which both help with inflammation within the joint. They help, ultrasound specifically helps to break up scar tissue that may be forming. Electrical stim, mechanical traction both help relieve the pressure in the joint by relaxing the muscles and stretching the muscles out. They help with inflammation. So there's a myriad of physical treatments that we can do to the body, stretching the tissue, strengthening, a myriad of treatments that we can do to help prevent abnormal healing. But most importantly, again, is to facilitate as normal level of function as possible.
And let's say somebody was in an accident years earlier, or still having problems. They come and see you. You say you can't help them. What would be the major one or two effects on how much you could help them?
How much scar tissue has been developed? You know, how long and how much how long ago that the trauma was, and how much damage was done. So you can have a minor car accident that causes a lot of problems, and you can have a lesser car accident that causes major traumas as well. It's a simple matter of how quickly you receive treatment and how normal or how much damage has been done totally dictates how normal your body will be able to function after the fact.
And will you be able to determine that in your examination?
Most of the time, yes. In a short period of time. Sometimes it takes a few visits to see how a patient's going to respond to the treatment they're having. Because sometimes the x-rays and MRIs will show there's a tremendous amount of permanent damage here. Other times it's less obvious. And we've just got to see how you're going to respond to your treatments for a few visits.
So it sounds like it's a combination of not only the consultation and the exam, but maybe how the patient responds initially also.
Exactly.
Okay. Well, that makes sense. Okay, so that is the answer to why you cannot feel pain immediately after an accident, or why you can feel pain years later. And again, this is Dr. Paul with Car Injury Care TV.